Every year you're told to get your flu shot. So you may think, well, nothing's changed, so why bother? Dr. Roy Buchinski has joined us in the UH Broadcast Center to tell you there's always something new with the flu, including a vaccine made just for those who are 65 and older. Dr. Buchinski is the Chief Wellness Officer at University Hospital. So welcome back to the show. It's good to have you.
Thank you very much.
Now, before we get to the age-specific vaccine, let's talk about why do we have to get a flu shot every year?
Well, the flu strain from last year is not necessarily the same as the flu strain for this year. So we make a vaccine that basically anticipates which viral strains are going to be prominent in the community for that year.
Okay.
Now, what happens is, although this is very effective and powerful, it is not always perfect. And sometimes the viruses undergo mutations, and sometimes these viruses and these bugs are smarter than the drugs.
Okay. So we got to, your advice is going to be we need to get a flu shot every single year. Everybody, right?
So the guidelines from the CDC recommend that everybody from the ages of 6 months and older should be vaccinated. So basically, the people that are at highest risk are those at the extremes of age. If you're over 65, even though you feel young, your immunity is lowered. And if you're under the age of 5 but over 6 months, you are at high risk and you should be vaccinated for sure in that high risk category.
Okay. But as I mentioned earlier, there is this flu vaccine for those 65 and older. So talk about that particular type of vaccine.
Right. So this vaccine is a high-dose flu vaccine. So when you administer it to a patient, you're going to get a higher increase in the antibodies and therefore in the immunity and the resistance of that individual. It's important in the 65 and above category because those individuals are at higher risk because they may have lowered immunity. So you want them to have a higher immunity. It has been shown that a high-dose flu vaccine lowers the risk of morbidity and mortality by 36% in individuals over the age of 65 compared to a normal dose vaccine.
All right, so what if we get the vaccine and we still get the flu?
So the treatment very much is symptomatic in most cases. In other words, giving person hydration, and that includes chicken soup as well, but also treating headaches, treating muscle aches, getting lots of rest and fluids. There's also an antiviral medication that if you take that in the first 48 hours can actually lower the severity as well as the duration of the flu illness.
All right, so how can you tell if it's the flu and not a cold?
That's a great question. The hallmark of flu is fever, muscle aches, and headaches. You feel like you've been hit by a Mack truck. The cold is a little bit different. You may not have a fever, you'll have a running nose, you may have a dry cough, but you don't necessarily have a high fever and you don't necessarily have muscle aches.
Okay, and you can't get the flu from the vaccine, right?
It's impossible. The flu vaccine is a dead vaccine. It's inactivated. You may get a little bit of muscle aches or a little bit of a sniffles or a low-grade fever for 24 hours. It's not the flu. It is a reaction to the dead antigen.
All right, great information. If you haven't yet gotten your flu shot for this year, don't wait, get it now. It's the first line of defense in protecting yourself from the possibly deadly consequences of the flu and its complications. My thanks to Dr. Buchinski for sharing this really important flu-fighting information.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or visit www.uhhospitals.org/lifelonghealth.